Well, the surgical procedures for breast cancer can vary from removal of the entire breast to just removal of small portions of the breast coupled with radiation therapy. The key to successful surgical treatment is multidisciplinary input from all of the members of the multidisciplinary team in order to make the best decisions about not only surgical therapy, but radiation therapy and types of chemotherapy. Here at Holy Cross, all of our patients who are diagnosed with breast cancer are presented at a multidisciplinary tumor board in order to discuss all of the options for treatment, both surgical and non-surgical. We don't want to do a surgical procedure until we've discussed this with our medical oncology and radiation oncology colleagues, as well as getting input from other breast cancer professionals. Once that discussion has been made, a decision will be made as to whether to preserve the breast or not. Preserving the breast requires removal of the breast cancer along with a rim of normal tissue around it. If the tumor is too large, or if the biology is such that the patient would not do well with conserving the breast, then a mastectomy would be performed, which is removal of all of the breast tissue. Usually as a part of mastectomy, as well as partial mastectomy, the lymph nodes under the arm are sampled to see if there's any evidence of spread. Knowing the status of these lymph nodes helps us determine additional therapies, including radiation therapy and sometimes chemotherapy. There are several components to recovery. There is recovery from a surgical procedure, there is recovery from an oncologic procedure, there is recovery from radiation therapy, there's the mental recovery from the stress of the diagnosis of breast cancer, and then there's long-term survivalship, the fear that the tumor may recur. So most women will tell you that they are almost never recovered. The initial recovery from surgical procedures in the modern era is actually very, very good. We focus here at Holy Cross specifically on pain management related to surgical procedures, both partial mastectomy or lumpectomy and mastectomy along with reconstruction. We use special pain protocols so that the discomfort postoperatively is minimized. Most patients after removal of a portion of the breast or lumpectomy will be recovered in several days. Patients who undergo mastectomy with reconstructive procedures, this takes several weeks to months to recover, but the recovery is much improved by using modern-day pain control techniques.